Do you know there are 1.5 to 5 million fungal species on the planet Earth, and out of those, more than 85 species live on our skin. Like many microbes, there are helpful fungi and harmful fungi. When harmful fungi invade the body, they can be difficult to kill, as they can survive in the environment and reinfect the person trying to get better. There are several types of fungal infections that can affect your skin, and many people suffer from fungal infections at least once in their life. A recent population-based survey reported that these infections are rarely managed properly, and the prevalence of fungal skin infections is expected to reach 20 to 25% of the world's population in coming decades. Although there are a number of fungi that can cause superficial skin fungal infections like Candida, Malassezia, etc., but the most common of them belong to a group known as dermatophytes. Dermatophytes are mainly composed of three species of fungi: the Trichophyton, Epidermophyton, and Microsporum, and together they can cause more than 60 to 80% of superficial skin infections in humans. The infection that these dermatophytes cause is known as dermatophytosis, also known as tinea. Tinea is derived from the Latin, which stands for worm, because formerly it was considered to be an infection caused by a worm-like parasite. Hence, it is still more commonly known as ringworm. Ring-shaped red rash is seen, that's where it gets its name, the ringworm. So in this video, we will talk about some of these superficial fungal skin infections caused by dermatophytes, various measures that you can do to prevent them in the first place, and then we will discuss how to treat them and prevent their reoccurrence. We will also discuss some of the lifestyle modifications you can do to prevent such infections. If you want to jump straight to the treatment part, you can do so by scrolling through the timeline of the video below, and in the coming videos we will also be discussing about the infections caused by Candida and Malassezia. So make sure to subscribe and press the bell icon so you don't miss out on those videos. Now let's understand how these fungi damage our skin and cause infection. The spores from these fungi penetrate the skin through scratching or small cuts on the skin. These spores get embedded in the skin, and there can be various factors that promote the growth of these fungal spores in our skin. The alkaline pH, wet and warm skin conditions, poor hygiene, contact with pets, all are favorable for the growth of these fungi. When I use the term superficial fungal infections, it means that the infection is present only in the topmost layers of the skin. As many of you may know, our skin contains 4 to 5 layers depending upon the region of the body. These dermatophytes only affect the topmost layer of the skin known as stratum corneum. This layer usually consists of dead cells in which keratin is present. These fungi break down the keratin present in your stratum corneum by producing an enzyme known as keratinase, and they use that as their food. This causes inflammation in the skin, which occurs due to an allergic reaction in the skin against these fungal products. Our defense cells start releasing chemicals that cause inflammation, which is the redness and itching in the infected area. These fungi can not only affect the keratinized layers of the skin, but also the keratinized layers of our hair and nails. These layers also contain keratin, which is used by these fungi, and this leads to an infection of the hair and nails. Now let's look at the risk factors and causes which makes a person susceptible to tinea infections. Excessive sweating in areas like groins, underarms can be an important risk factor. Environmental conditions like hot and humid temperatures provide more favorable conditions for these organisms to grow. If you're keeping your body parts wet for longer durations, the chances of getting these superficial fungal infection increases. Unexposed body parts like feet, scalp, skin areas between the toes and fingers are more susceptible as you keep them covered with shoes and clothes. They are left warm and wet, which causes these areas to become a suitable ground for the breeding of these fungal infections. Improper hygienic conditions of your household like infected clothes, blankets, bed linens, or contaminated places like doorknobs can also act as a source of infection. Now, all people are not equally susceptible. It depends upon the immunity of the individual and the pH of the skin. Alkaline pH favors the growth of the fungus. People who are low in a certain type of proteins known as defensins, which is a type of immunity providing protein, are more susceptible to these infections. And persons already suffering from some underlying disease like diabetes have higher rate of fungal infections as compared to normal healthy individuals. These infections also occur more in people with an immunocompromised state. It simply means that a person's immune system cannot fight from infections. Such individuals mostly are AIDS patients or people who had undergone some organ transplant surgeries. These organisms frequently attack such type of individuals. People who take steroidal medications for some other underlying conditions like asthma are also frequently seen to have these infections. Younger and older people are affected more as compared to healthy young adults. Now let's talk about the different types of tinea infections. Tinea can be of various types depending upon the location of the infection on the body. Most common infections include tinea pedis, which is a fungal infection of feet. We have tinea capitis, which is a fungal infection of the scalp. Tinea unguium, which is a fungal infection of nails. We also have tinea cruris, which is very common, and it is a fungal infection occurring in folds of our skin like our axillae, groin and between the hips. And similarly, we have tinea corporis, which is a fungal infection involving parts of the body not covered with hair. Tinea barbae is a fungal infection of the beard. And we have tinea amenticea, which is a thick, sticky fungal infection of scalp following infection or trauma. Now let's look at some of these tinea infections which are very common in more detail. And the first one we are going to talk about is tinea pedis. Pedis in Latin stands for foot, and it is the most common dermatophyte fungal infection. This fungal infection usually begins between the toes. It is commonly known as athlete's foot because athletes like runners and football players are frequently affected by these infections. It is commonly seen in people with excessive sweating in their feet while confined within tight-fitting shoes. It spreads very easily from one person to another. That's why we must avoid each other's towels, socks and other clothes. It is often self-diagnosed as you can see the symptoms by yourself. You can see those areas become red and very itchy. It almost feels satisfying when you keep scratching those areas between your toes. The skin between your toes seems moist all the time, and this can also lead to development of a foul smell from your feet. Another common example of tinea infection is tinea capitis, and it is a major issue as it sometimes causes permanent baldness. That's why it's very important to understand it. Capitis stands for scalp, so it is a fungal infection affecting the scalp area and develops inside the hair follicles and skin of the scalp. If you're using each other's combs, you can get these infections very easily. You can also acquire these infections frequently from your pets. Its symptoms are very straightforward, and the diagnosis is also based upon the examination of the scalp. You can experience a very itchy and sometimes a painful scalp. The hair becomes brittle, they lose their shine and break very easily upon minimal plucking. You can also experience low-grade fever. More severe forms are presented with pus coming out and permanent bald spots and scarring, which is stressful both mentally and aesthetically. The diagnosis is made by examining those spots on a scalp under UV Woods lamp. Your doctor can also take samples of your hair to examine them under the microscope and some of the samples from the skin of scalp to confirm the diagnosis. Now let's look at another superficial fungal infection known as tinea cruris, which is very common. The word crura signifies legs, but the infection that we are going to talk about does not occur on the legs but in between the legs, that is the groin area. It affects the skin of the genitals, inner thighs and sometimes buttocks. This condition is known as jock itch. This condition is common in people who wear tight clothing. Tight clothing traps moisture and favors the growth of this fungus. Symptoms of tinea cruris include severe itching in the groin area. The area becomes red and often a ring-shaped rash develops in the area. We will look at other types of tinea like tinea unguium and tinea barbae in separate videos. So make sure to subscribe to Med Simplified and hit the bell icon so you don't miss out on those videos. Now we will look at the treatment part of these tinea infections, especially the tinea pedis, tinea cruris and tinea corporis. Because fungi thrive in moist, warm environments, patients should be encouraged to wear loose-fitting garments made of cotton or synthetic materials designed to wick moisture away from the surface. Socks should also have similar properties. Areas likely to become infected should be dried completely, covering with clothes. Patients should be advised to avoid walking barefoot and sharing garments. If we look at the treatment itself, it can be divided into topical antifungals, which are applied over the skin, and oral medication. Topical medication includes soaps, body washes, lotions, creams, and gels. We will look at them one by one and see which one is best for you. Topical antifungals are the first line of treatment for many patients of tinea corporis, tinea cruris, as well as tinea pedis. The most effective topical antifungals include drugs like azoles, which include clotrimazole, ketoconazole, oxyconazole, and sertaconazole. We also have allyl amines like terbinafine and butanafine. And we have newer antifungals like cyclopyroxolamine and selenium sulfide, which are also very effective. Now you can start the treatment with a soap or body wash containing clotrimazole 1% or ketoconazole 2% and use that to wash your body every day. You can also use cyclopyroxolamine or selenium sulfide washes, especially if you are having fungal infections of the scalp or hair. When you apply the soap or the body wash, make sure to leave it on for a few minutes before you wash it off so as to have the maximum antifungal effect. Next, we move on to the antifungal creams, gels, or lotions you should use. Again, similar antifungal drugs are present in these creams and lotions like ketoconazole 2%, clotrimazole 1%, luliconazole 1%, ibuproconazole or sertaconazole. Selenium sulfide 2.5% lotion and cyclopyrox 1% cream are also very effective. You can apply these creams and lotions twice daily, once in the morning and once before sleeping. I have provided the links to some of the best antifungal soaps, body washes, creams and lotions in the description box down below, so make sure to check them out. As per my experience as a dermatologist, I have found luliconazole 1% cream, selenium sulfide and cyclopyroxolamine creams to be quite effective in the treatment of tinea cruris and tinea corporis. The treatment with these topical drugs should be continued for a minimum of 4 weeks if you have a mild infection. And if you have a severe infection involving larger areas of skin or fungal infection that reoccurs after you stop the treatment, you should continue the topical treatment for at least 6 to 8 weeks. Now let's talk about the oral antifungal drugs that we use for the treatment of tinea. Oral antifungal drugs are indicated in case of extensive involvement of the skin and in patients who fail to respond to the topical therapy such as creams and lotions. Now there are 3 main FDA approved antifungal drugs: terbinafine, itraconazole and fluconazole. These drugs act by inhibiting certain enzymes that are very important for the fungi to synthesize their cell wall. Without a proper cell wall, these fungi cannot grow and they soon die. Out of these 3, fluconazole is mainly indicated for the treatment of vaginal candidiasis, oropharyngeal candidiasis, and esophageal candidiasis, while itraconazole and terbinafine are mainly used for the treatment of tinea, and we will focus on them. Itraconazole is available in 100 mg, 200 mg, and 400 mg dosages. For tinea cruris, usually 100 mg dose twice a day or 200 mg dose once a day for 2 weeks is the minimum you should take this drug. Terbinafine has been used for tinea corporis and tinea cruris at 250 mg tablet daily for 2 to 4 weeks. These drugs are usually not available over the counter, so you need a prescription from a dermatologist, or else you can also get a prescription from many pharmacy websites which have online consultations with a dermatologist. While undergoing this treatment, Make sure you take proper care of your hygiene and wash your clothes regularly with hot water. Also make sure to iron your undergarments before each use, as many of the times the fungal spores can get deposited in our inner wear clothes and this can cause frequent relapses and treatment failures. So that was all about Tinea cruris and Tinea corporis. In the coming videos, we will discuss more about Tinea pedis, Tinea capitis and onychomycosis, which is the fungal infection of the nails, and many other topics related to fungal infections, as these are such a common problem. Also, I am going to make some videos regarding home remedies and natural methods to treat tinea infections. So make sure to subscribe and hit the bell icon so you don't miss out on those videos. Thank you so much for watching this video. If you found this video helpful, make sure to like the video and also share with someone who you think might find it useful. Bye bye and see you in the next video.